Ontario healthcare workers are planning to rally outside the Premier's office in Etobicoke tomorrow in response to funding cuts by the provincial government. The government's fall economic statement shows a plan to cut hospital funding by 10% in real terms over 3 years by 2027-28, according to CUPE. The Ontario Council of Hospital Unions shared a report last month stating that the government's budgetary constraints on hospital funding will further sink an already drowning healthcare system. It also says Ontario hospitals will be dealing with longer wait times, rushed care, and overcrowding due to funding shortfalls. And for more on this, we are joined by the president of CUPE's hospital sector, Michael Hurley. Michael, it's great to have you here with us this evening. Thanks for your time.
Thank you for having me.
Now, tomorrow you're planning a rally at the Premier's office. Can you tell us what has led up to this? We know the main issue here is funding for healthcare.
Well, the Independent Financial Accountability Office is predicting that Ontario hospitals will have to close about 2,400 beds over the next 3 years and eliminate 7,000 nursing positions, 1,800 PSW positions, and an equivalent number of support staff because they've been told to come in with budgets of 2% a year when their costs are more like 6% a year. So over those 3 years, a 10% cut for a system which is already struggling to deal with an aging and growing population.
Loss of hospital beds, the shortage of staff for the average hospital, whether that be in a big city like Toronto or a smaller town. What does a 10% cut really look like?
Well, I mean, it's enormous. I mean, you take a hospital like Oak Valley, it's already operating on any given month at 131 capacity, 131% over capacity, 141% over capacity. This is the norm in Ontario hospitals. You've got 2,000 people on stretchers who can't get admitted to beds. You've got 200,000 people waiting for surgeries and 73,000 of those waiting beyond the medically recommended time limits for their procedures. And you've got a provincial government which promised to clear the surgical backlogs, to end hallway medicine, to fund hospitals properly. And that's why we're going to be protesting at Premier Ford's constituency office tomorrow, because obviously they have not delivered that. And in fact, they plan to worsen the situation significantly.
Now, what has the province said as to why it's making these cuts during this time, especially like you mentioned, all the wait times for surgeries and hospitals overflowing right now?
Well, they would say no government in Ontario history has ever spent more on hospitals than we have. And that is true. But unfortunately, no government has ever spent less per resident. No government has ever had fewer hospital beds or fewer staff for those beds. And as a result, we've got the fewest staff and beds of any province in the country, of any country with a developed economy, and we just can't cope. And the plan is for that to get worse, unfortunately. And healthcare workers, hospital staff are saying, no, not on our watch. We see the suffering of these patients. We see their families agonizing with them as they wait on these stretchers and as they wait on these waiting lists, as they're sent home early when they should be kept longer in hospital because you have to clear the beds. The suffering is acute, and we want the government to fund these institutions properly.
And do you have any recommendations for the government on where they could give more funding, or any numbers that would be a good compromise?
Well, I mean, the Hospital Association calls for 6% a year. They say because aging adds about 3% to their costs, population growth, and then medical devices and the drugs they provide free to inpatients, medical technologies, all these things are expensive. They say they need about 6% a year just to tread water. And because of an aging, growing population, the pressures on the system are more and more and more acute. We need at least 6% a year, not the 2% that the provincial government is asked hospitals to budget at. And obviously, we need at least 2,000 additional hospital beds in the province, staffed, because that's the number of people on any given day that can't get beds.
Some really important issues, and that rally and protest taking place 10 a.m. tomorrow. President of CUPE Hospital Sector, Michael Hurley, thanks so much for joining us.